Hi, my name is Amy. Today we are focusing on safety of you as a patient or you as a service provider, what you put into consideration when you're going to look for a safe hospital or when you're going to provide services in a safe manner. We have various goals that WHO has put in place to ensure that we've given a safe service or you've received a safe service. So the first one is proper identification. So when you go to a facility, were you identified? Whenever you change from the consultation to either pharmacy or to laboratory, were you identified and how were you identified? The next thing that you have to put into consideration is effective communication. Whenever you're going to seek for that service and you are given information, is it properly transmitted? Did you understand it? Did they miss something out? If you are in the inpatient and the doctor did a ward round and they gave you a service and in your hearing you heard things are supposed to be done, were they done? Let's move to the safe medication use. Whenever you are getting admitted, for example, were the drugs that you came to the hospital with taken into consideration? What happened to your drugs that you are taking at home? Were you explained to properly on the side effects of these drugs? If the drugs are looking alike or they are having the name that sounds alike, did somebody explain to you that this one is different from this and this is how you should take care of it? And if you are in a hospital and you're working, what mechanisms do you have to sort the sound alike drugs and the look alike drugs so that you don't mix in the process? Let's come to the next thing that you have to look at: infection prevention and control. When you walked in that facility, do you see hand hygiene areas around? Do you see a sink, soap, a hand rub? Were you told what to do? Do you see the nurse or the doctor cleaning hands before they touch you? Are you seeing them cleaning hands after they have touched you? Are you seeing them washing hands after touching the surrounding of your area? Were they able to screen you from the communicable diseases? If they didn't, it means somebody who came before you was also not screened. So it means you might be getting that infection. Those are things you have to put into consideration. Let's move again on what you have to look at. Falls. You might be at a risk of fall. You might be a patient who is drowsy. You might be having a fracture, or you might be having an old patient who might fall from the bed. So what mechanisms were put in place to identify you as a risk patient and the care that you are given that is very distinct for you so that you don't fall? And again, if you fail, what was done to you? Then again, finally, safe surgery. When you're going to have a surgical procedure, again, you might be in a total anesthesia, so you want to be seeing or hearing what is happening. But again, you can ask, whenever a surgery has ended, did they count all the tools to ensure that they have removed everything? Were they able to identify themselves to you? Do you know the name of the surgeon who took care of you, and the anesthetist and the nurses and the entire team? Do you know them? If you are able to find all these things in the hospital you've gone to, that is a safe service provider, and that is a safe institution to work with. Thank you and have a blessed week.